Welcome to the lecture on the King Airway, which is to be used as a rescue airway for patients that are being resuscitated and no longer breathing. The King Airway works by having two balloons, one that occludes the esophagus, the other occludes the oropharynx. That way air is supplied to the area of the vocal cords. Both are inflated at the same time by the same site. Air holes between the two balloons ventilate the airway when the bag is used to push air into the tube. This picture demonstrates how the tube is down into the esophagus. The distal tube, or the one that is towards the tip, occludes the esophagus, while the proximal one, or the one behind the tongue, occludes the oropharynx. Air is then injected into the tube and goes between the two balloons into the airway. Here's the kit as it's supplied with the syringe, the tube, and lubricant. That's the port for the air infusion. That's the proximal balloon and the distal balloon. In between the two are the air ports. You infuse the air into the single air port and it inflates both balloons. There are markings on the tube that indicate the depth of the tube into the patient's airway. To deflate, simply reverse the process and pull air out of the port and it will deflate the balloon. Indications for using the King Airway are for advanced life support. It is used for a failed airway rescue device. For basic life support, it is used for those patients that have respiratory arrest. The contraindication to using the King Airway is a conscious patient that has a gag reflex. In selecting the correct tube size and inflation volume, look at the color of the tube tip. For yellow, it is for patients that are 4 to 5 feet tall, and you use 50 milliliters. For patients that are 5 to 6 feet tall, select the red tube and you infuse 60 milliliters of air. For patients greater than 6 feet, the purple tube is used and 70 milliliters of air is infused. Here are the 3 different tube sizes in the kits: yellow, red, and purple. The procedure for inserting the King Airway is fairly simple. First, apply lubrication to the tip of the tube. Use the chin lift if it is not contraindicated. Next, insert the tube at the corner of the mouth with the tube held out laterally. During the insertion, rotate the tube forward. Aim to go under the tongue in the midline. Advance to the base of the connector. Apply lubricant to the end of the tube. Use the chin lift to open the airway. Place the tube in the corner of the mouth. Advance the tube, slowly rotating it to the midline, trying to go underneath the tongue. Continue to insert the tube all the way to the hub. Inflate the tubes with the correct amount of air. Next, while bagging the patient, slowly pull out the tube until there is free air movement into the airway. Monitor the patient carefully. Use the King Airway monitoring form to document the patient's status. Watch for the development of a pneumothorax. Monitor the system for any air leaks and add air as needed. To remove the king airway, it should only be done if the patient regains consciousness and is unable to tolerate the device. Suctioning should be ready to use.